Alors, bon après-midi, bonjour tout le monde. Thank you very much for joining us, either in the Sir John A. Macdonald building where we are or on the phones. Just by way of opening comments, the House, as you know, is sitting. There are votes, procedural votes that may happen in the next half an hour or so. We don't expect that Patty and I will have to leave, but if we do have to leave because of a vote, you'll understand that we have to cross the street to get to the House. I'm here today in my new capacity as chair of the COVID-19 Response Cabinet Committee and as the Minister of Intergovernmental Affairs. I look forward very much to working with my colleagues and all Canadians as we continue as a country to address the ongoing pandemic. With me are Minister Anand. Anita is joining us remotely. Here at the table, my colleague, the Health Minister, Minister Hyris, and Canada's Chief Public Health Officer, Dr. Tam, and the Deputy Chief Public Health Officer, Dr. New. Nous avons aujourd'hui la ministre Anand qui est avec nous, la ministre Hyris, l'administratrice en chef de la santé publique du Canada, la Dr. Tam, ainsi que l'administrateur en chef adjoint de la santé publique, le Dr. New. The COVID-19 numbers we have seen recently are obviously extremely concerning. We understand and share the anxiety of parents, friends, colleagues, and family members for the health and safety of their loved ones. This obviously remains the top priority of the Government of Canada and indeed all governments. Nous partageons l'anxiété des amis, des familles, des collègues pour le bien-être de leurs proches et je tiens à réaffirmer que notre priorité est la santé et la sécurité de tous les Canadiens. The small steps we take today to keep each other healthy and safe will have a huge impact for our families, communities, and for the country. I'll start by reminding all Canadians to continue to follow public health experts regarding the practicing of physical distancing, hand washing, and wearing a mask to protect yourself and to help protect others as well. J'aimerais rappeler aux Canadiens de continuer de suivre les recommandations de nos experts de la santé publique, c'est-à-dire la distanciation sociale, le lavage des mains et le port du masque. Je tiens également à vous rappeler que l'application Alerte COVID est un outil important qui nous permet de garder en sécurité l'un l'autre. L'application est déjà disponible à Terre-Neuve et Labrador, au Nouveau-Brunswick, en Ontario et en Saskatchewan. Notre gouvernement collabore activement avec les autres provinces et territoires et l'application sera active très prochainement dans d'autres régions du Canada aussi. Je vous encourage tous à la télécharger dès aujourd'hui. As a reminder, the COVID Alert app is an important tool to keeping each other safe. It's already available and active in Newfoundland and Labrador, in New Brunswick, Ontario, and Saskatchewan. Our government is actively working with other provinces and territories, and it will be rolled out to more Canadians very shortly. And I encourage everyone to download it today. No matter the situation ahead of us, we will continue to adapt our approach to this ever-changing pandemic environment, working with provincial, territorial, municipal, and community partners, Indigenous partners all across the country. Once again, thank you for being here today. Une fois encore, merci de votre présence aujourd'hui. Je vais maintenant demander à notre collègue, la ministre Anand, de faire une annonce et ensuite la ministre Hyris et nos médecins vont ensuite prendre la parole. So, Anita, over to you.
Merci, Dominique, et bon après-midi, tout le monde. As we continue to see the rise in reported infections, we know that now, more than ever, each and every one of us must redouble our efforts to help curtail the spread of COVID-19. Notre gouvernement continue de mettre l'accent sur la protection de la santé, de la sécurité de toute la population canadienne. De plus, Mon ministère,
Moreover, my
Services
department,
publics et
Public
approvisionnement,
Services and Procurement
demeure
Canada,
déterminé à assurer un
remains focused on
approvisionnement
helping Canada
suffisant
be ready
en
when it
équipement de
comes to having
protection
enough
individuelle ou
personal
EPI
protective
est un
equipment or
autre
PPE
fournisseur
and
médical
other
et
medical
ce
supplies
pour faire
for
face à
any
toute
potential
éventualité.
scenario.
Cela comprend l'achat d'EPI, de
That
traitements
includes
et de tests de
procuring
dépistage qui
essential
sont
personal protective
essentiels pour
equipment,
protéger
treatments,
les
and
Canadiennes
tests
et
to
les
protect
Canadiens.
Canadians.
With renewed efforts to keep community transmission at a minimum, testing and tracing are more important than ever. Today, I am announcing that the Government of Canada has signed a new agreement with Abbott Rapid Diagnostics for up to 7.9 million rapid point-of-care tests for COVID-19. This is a nasal swab-based point-of-care test with results in approximately 15 minutes. As with many of our agreements for equipment, tests, and vaccines, we have pursued an advanced purchase agreement to secure Canada's access to these tests, conditional on Health Canada regulatory approval. This has been our proactive approach, and we will continue to employ it in these types of procurements. Required assessments and validations are taking place expeditiously, and at the same time, we are continuing to pursue other rapid test agreements as well. These rapid tests will aid in meeting the urgent demand from provinces and territories to test Canadians and reduce wait times for results, which is key to reducing the spread of the virus. In addition to testing, I will also provide an update on other measures employed to prepare for future phases of this pandemic. Through our procurements, we now have more than 2 billion items of PPE for Canadians. We will continue to receive steady, ongoing deliveries of all types of PPE in the coming months. With this increase in numbers of PPE deliveries, including 40% of the total dollar value of contracts now going to domestic companies, our existing warehouses are stretched to capacity. This is a sign of proactive PPE procurements. Mais aussi, c'est pourquoi je suis ravie d'annoncer qu'au nom de l'Agence de la santé publique du Canada, Services publics et l'approvisionnement a attribué un nouveau contrat à Metro Logistics Inc. de Montréal afin d'aider à l'entreposage et la distribution de pays aux provinces et territoires. Alors que la livraison de commandes se poursuit, cette capacité accrue de l'Agence de la santé publique est entreposée et à distribuer le pays est primordial. In addition to PPE, logistics will be just as important when it comes to distributing vaccines, with bilateral agreements now in place that provide Canada with access to 6 different vaccine candidates and up to 282 million doses of vaccines. We will be ready to deliver vaccines to provinces and territories as soon as one or more vaccines are approved for safety and efficacy. It is important to note that Canada has already in place a robust system for vaccine distribution to ensure access to vaccines based on seasonal flu and other routine immunization programs. However, depending on which COVID-19 vaccines are ultimately approved, warehousing and delivery will come with unique specifications and will require a wholly unique logistics solution. In addition to the detailed planning underway inside government, we are also seeking information from industry directly to support the transport, storage, and distribution of potential COVID-19 vaccines. Last week, the Government of Canada issued a broad letter of interest to industry, inviting input on industry's logistic capabilities and expertise. We know that planning for a national mass distribution of new vaccines will be complex, and we will leverage all the resources at our disposal to achieve this. In short, when a vaccine is ready, Canada will be ready also. Our approach has been and continues to be proactive and aggressive. In closing, let me offer some assurance to Canadians. As the Prime Minister has said, we have your back. We are in this together, and we will get through this together. And I personally will not rest until these procurements for Canadians are in place for Canadians here and now. Throughout protective equipment, through treatments, through an eventual vaccine, and through the collective efforts of each and every citizen, we will beat this virus together. Merci beaucoup, Miigwech. Thank you so much.
Merci beaucoup, Anita. Alors, maintenant, la ministre de la Santé va dire quelques mots et ensuite le Dr Tam et le Dr New.
Merci, Dominique. Bon après-midi. Les nouvelles annoncées par Québec hier sont difficiles. Je veux commencer en parlant de ressources qui sont disponibles au Canada.ca. N'hésitez pas à faire comme plus de 400 000 personnes qui sont allées sur notre site pour prendre soin de leur santé mentale et parler avec un professionnel. This spring, we allocated $4.28 billion to the provinces and territories to increase testing and contact tracing. For an overview on how provinces are meeting their goals, you can follow their progress on canada.ca/coronavirus. We also know that new tools are needed to fight COVID-19, and we're working around the clock on the approval and procurement, as Minister Anand talked about, of new testing technologies, so Canadians have access to better and faster testing no matter where they live. We've approved 36 tests to date, including 2 that are point of care that can help with rapid testing in specific populations like rural and remote communities. To date, we have not received any home test kits for review, but we're actively engaging with companies that produce these types of tests to encourage them to apply here in Canada. And when they apply, we will be ready. We have doubled our people, and we've sped up our processes to review tests and grant decisions quickly within 40 days of an application. The world is seized with COVID-19, and researchers and scientists are working day and night to work on new tools that will better track and treat this illness. As we learn to live with COVID-19, testing will continue to be a key part of our public health approach, and will continue to be there for provinces and territories and regions that are struggling with outbreaks of COVID-19, including mobilizing federal testing surge capacity to help them with those needs. But we can't underestimate the power of our own behavior. The most effective public health measures continue to be washing our hands, physical distancing, wearing a mask, and socializing less. I also implore people who are not feeling well to stay at home when they're sick and to reach out to local public health for advice. And please download the COVID Alert app and join the 3 million Canadians that have done so to date. COVID-19 is taking a toll on all of us. It is hard to stay apart, especially when others are reaching out. But it is an act of love. We can protect each other, we can flatten the curve again, and we can save lives. Merci.
Merci beaucoup, Patty. Dr. Tam?
Good afternoon and bonjour à toutes et à tous. There have been 155,301 cases of COVID-19 in Canada, including 9,278 deaths. Labs across Canada tested an average of over 71,000 people daily over the past week, with a 1.7% testing positive. Yesterday, a total of 2,176 cases were reported nationally. 437 of these were backlogged cases from the weekend, and 1,739 were newly identified yesterday. This means daily case counts has now reached the peak of daily cases seen in April, and the average daily case count has increased to 1,412 cases being reported during the most recent 7 days. The fact that cases are now at the same level as during the initial peak is worrisome, But at the same time, there are clear differences in the epidemiology, with younger age groups predominating among cases, and we are testing and detecting more. Things have escalated quickly, and they can escalate further unless we all work together to slow the spread of the virus. There is no doubt that testing, tracing, and isolating in order to interrupt transmission of the virus and prevent further infections is a cornerstone of our pandemic response. Public health authorities are working hard to find a range of testing solutions to improve access and speed up the turnaround time for results. In Ontario, for example, as in Alberta, tests can now be performed in pharmacies. British Columbia has introduced a spit and swish testing method, which will be used as an alternative to the nasal swab, especially for collecting samples from children. Health Canada is reviewing a range of simpler to use and faster tests. As the regulator, Health Canada is responsible for ensuring the safety, effectiveness, and quality of all tests, which is crucial for disease management. For example, an underperforming test could result in a high number of false negative results, where people think they aren't infected when they are, leading to unintentional exposures. This is why the review process is so important and why no corners can be cut. As the number of cases rise and the demand for testing increases, testing will be most important for those who have COVID-19 symptoms, have been exposed to a confirmed case, or are part of an outbreak investigation, or have been otherwise advised by local public health to get tested. As I have said before, getting tested for COVID-19 is an act of kindness that can protect you, your family, and your community. I also wanted to mention a new online tool called COVID Trends, released by the Public Health Agency of Canada. It provides you with the number of confirmed COVID-19 cases in your area within the last 14 days. This is another way to stay informed about COVID-19 activities in your community and help you make informed decisions to keep yourself and your family safer. And as always, I want to end by asking everyone to follow the public health practices we know to be effective, including physical distancing, frequent hand washing, and wearing a non-medical mask in closed spaces, crowded places, and close contact situations where distancing is difficult. Most importantly, stay home and self-isolate if you have symptoms, even mild ones. Thank you.
Dr. New?
OK. Merci. Bonjour à toutes et à tous. Il y a eu 155 301 cas de COVID-19 au Canada, dont 9 278 décès. Au cours de la dernière semaine, des laboratoires de partout au pays ont analysé les tests de dépistage de plus de 71 000 personnes en moyenne par jour, dont 1,7 ont obtenu un résultat positif. En tout, 2 176 cas ont été signalés hier à l'échelle nationale. De ce total, 437 cas sont survenus en fin de semaine et 1 739 sont de nouveaux cas qui ont été signalés hier. Cela signifie que le nombre de cas signalés quotidiennement a maintenant atteint le pic observé en avril dernier et que la moyenne est passée à 1 412 cas pour les 7 derniers jours. Le fait que les cas sont maintenus aussi nombreux que lors du pic initial est préoccupant. En revanche, les données épidémiologiques font ressortir de nettes différences entre les tranches d'âge, la majorité des cas survenant chez les jeunes, et nous réalisons plus de tests et détectons plus de cas. La situation s'est détériorée rapidement et elle peut encore s'aggraver si nous ne travaillons pas tous ensemble pour ralentir la propagation du virus. Il ne fait aucun doute que le dépistage, la recherche des contacts et l'isolement pour interrompre la transmission du virus et prévenir les nouveaux cas constituent des éléments fondamentaux de notre intervention contre la pandémie de COVID-19. Les autorités de santé publique travaillent sans relâche pour trouver différents moyens de dépistage permettant d'améliorer l'accès et de raccourcir les délais d'obtention des résultats. En Ontario, par exemple, comme en Alberta, les tests peuvent désormais être effectués en pharmacie. La Colombie-Britannique a lancé un test salivaire qui servira de solution de rechange à l'écouvillonnage nasal, surtout pour les prélèvements d'échantillons chez les enfants. Santé Canada examine divers tests plus simples à utiliser et plus rapides. En tant qu'organisme de réglementation, le ministère est chargé de garantir l'innocuité, l'efficacité et la qualité de tous les tests, ce qui est essentiel pour lutter contre les maladies. À titre d'exemple, le manque d'efficacité d'un test pourrait conduire à un nombre élevé de résultats négatifs, c'est-à-dire que les personnes croient qu'elles ne sont pas infectées alors qu'elles le sont, et entraîner des expositions involontaires. C'est pourquoi le processus d'examen est si important et qu'il ne faut pas sauter d'étape. Alors que le nombre de cas à la demande de tests augmente, le dépistage sera particulièrement important pour les personnes qui présentent des symptômes de COVID-19 qui ont été exposés à un cas confirmé, qui sont visés par une enquête sur une éclosion ou à qui l'autorité locale de santé publique recommande le test. Comme on l'a déjà mentionné, se faire tester pour la COVID-19 est un acte de bienveillance pouvant vous protéger et protéger votre famille et votre collectivité. On souhaite également vous informer que l'Agence de la santé publique du Canada a lancé un nouvel outil en ligne appelé Tendance COVID. Il vous indique le nombre de cas confirmés de COVID-19 recensés dans votre région au cours des 14 derniers jours. Il s'agit d'une autre façon de vous tenir au courant de la situation dans votre collectivité pour prendre des décisions éclairées dans le but de mieux vous protéger, vous et votre famille. Pour terminer, comme à l'habitude, on demande à chacun de respecter les mesures de santé publique qui ont fait leur preuve. Maintenez une distance physique, lavez-vous souvent les mains et portez un masque non médical dans les espaces clos, les lieux bondés et les situations de contact étroites où la distanciation est difficile. Le plus important, restez à la maison et isolez-vous si vous avez des symptômes, même faibles. Merci.
Alors, merci beaucoup, Dr. New. Alors, on va procéder maintenant aux questions.
Oui, nous allons procéder à la période de questions. Nous allons commencer au téléphone avec 3 questions, avec une question de suivi chacun. Merci.
Merci. Thank you. Please press star 1 if you have a question. Faites étoile 1 pour toute question. La première question est de Marie Vestel de Le Devoir. La parole est à vous. Please go ahead.
Oui, bonjour. Ma question est pour vous, Monsieur Leblanc. Je voulais revenir sur la hausse des cas au Québec dont vous avez fait mention. Montréal et la ville de Québec sont maintenant considérées zone rouge. Est-ce qu'il est temps, selon vous, de permettre aux policiers d'aller chez les gens pour faire respecter les mesures sanitaires, les consignes d'éviter les rassemblements, puisque c'est là, semble-t-il, qu'est le réel problème là, de la deuxième vague?
Alors, comme vous savez, le premier ministre Trudeau a parlé avec le premier ministre Legault hier soir, simplement pour offrir une fois de nouveau la collaboration de notre gouvernement. Nous partageons l'inquiétude de tous les Canadiens et des Québécois, évidemment, avec ces chiffres qu'on a vus au Québec. Nous allons continuer de travailler avec les autorités québécoises de santé publique et de sécurité publique pour s'assurer que toutes les mesures nécessaires pour protéger les Canadiens sont en place. C'est une discussion que mon collègue, le ministre Blair, peut avoir avec son homologue québécois, mais en tout moment, le gouvernement fédéral demeure prêt à appuyer les autorités québécoises dans n'importe quelle mesure qui vont augmenter la protection et diminuer, évidemment, le nombre de cas inquiétants qu'on a vus au Québec.
Croyez-vous qu'une des ça serait de permettre aux policiers d'aller chez les gens pour s'assurer qu'on respecte les consignes? Et ma sous-question, vous avez aussi mentionné l'alerte COVID, l'application sur les téléphones. J'aimerais savoir où est-ce que vous en êtes dans les discussions là-dessus avec le Québec. Est-ce que Québec pourrait finalement changer d'idée et accepter de partager l'application pour freiner la deuxième vague?
Alors, moi, je répondrai en premier lieu et mon collègue, la ministre Haidou, va ensuite ajouter quelque chose. Sur l'application, vous avez raison, on travaille étroitement avec tous les provinces et territoires afin de s'assurer que tous les Canadiens puissent avoir accès à l'application COVID Alert. Alors, nous espérons avoir des nouvelles positives dans les prochains jours et au pire dans les prochaines semaines. Évidemment, la situation idéale, c'est que tous les Canadiens aient accès à cette application, y compris au Québec, mais nous sommes confiants qu'on peut travailler avec toutes les juridictions à travers les provinces et territoires afin de s'assurer que ce soit disponible et accessible à tout le monde. Et quant à la question d'envoyer des policiers pour faire respecter les mesures de santé publique, la juridiction et l'autorité est présentement dans la main des autorités québécoises. Et comme j'ai dit, à tout moment, nous demeurons prêts pour appuyer les autorités de santé publique ou de sécurité publique de la province du Québec ou d'ailleurs dans d'autres régions du Canada afin de s'assurer que tout est disponible pour protéger les Canadiens. Mais pour le moment, cette autorité existe dans les lois de la province du Québec. Mais nous allons continuer une discussion collaborative afin de voir si on ne peut pas les appuyer d'une façon accrue. Peut-être, Patty, you want to add something?
Minister Hyde, anything to add?
Just to repeat the answer in English, as you know, the Prime Minister spoke with Premiers Ford and Premier Legault last evening. The conversation was simply to reiterate our shared concern about the increase in COVID cases in those two provinces, but right across the country as well. And the Prime Minister reiterated that the Government of Canada is available to support in any way that would be helpful the authorities in Quebec and in Ontario, but that is true, obviously, in every other province and territory across the country. The authority in terms of using public safety officials, peace officers, to respect public health guidelines and public health regulations is properly in the hands of provincial authorities. They have that authority now. But of course, if there was a way that the Government of Canada could be supportive and helpful or do something that would enable them to do this important work more effectively, we would be wide open to having that conversation with any province that asks for our help.
Nous allons passer à la prochaine question au téléphone. Modérateur.
Next question over the phone.
Merci. Thank you. The next question is from Ryan Tumilty from the National Post. Please go ahead. Your line is now open. Votre ligne est ouverte.
Yeah, hi there. I'm wondering, this Abbott test, as well as some of the more rapid antigen tests that are out there and that I know the Health Canada is considering approving, when Canada gets to the point of distributing them, are you looking at distributing them with some manner of warning about the situations, I guess, in which they are most accurate? I know especially some of the antigen tests are really only accurate with people who are very infectious or symptomatic. I wonder if there's any concerns about that.
So, Patty will start, and then maybe Anita or the doctors if they want to add something.
Well, thank you very much. And in fact, that's part of the regulatory process to make sure that all components of the test are there, including appropriate instructions for the use of tests and when it might be appropriate to do so and what circumstances. But I will turn to Dr. Tam and Dr. New to speak a little bit more about those specific questions on those specific tests.
Yeah, so every test is a bit different. So the instructions and the application of the test will come with the manufacturer and through Health Canada's approval. What I always say is that from the federal provincial laboratory perspective, we are getting together to update guidance as needed in terms of how you use those tests in the best, most useful way as well. For example, obviously, a test that may have a slightly lower sensitivity may have to be used in a different way than one that has more sensitivity and specificity, i.e. the kind of test you want to use when you absolutely have to diagnose someone in terms of whether they are case or not, whereas something with a slightly lower sensitivity may be used more for, say, screening purposes. So those will be discussed also at the Special Advisory Committee and our Canadian Public Health Laboratory Network.
And if I could just add something as well, Dominic.
Go ahead.
The tests that we're procuring from Abbott are point-of-care rapid tests. They're not antigen tests. The antigen tests are being procured in other jurisdictions, but this particular contract relates to point-of-care rapid tests. It is a swab-based test, and I just wanted to put that clarification out there for you, Ryan. Thank you.
Bonjour, les ministres doivent partir dans 2 minutes, donc nous allons prendre une question dans la salle et par la suite, les docteurs vont rester pour répondre aux autres questions.
Sorry, just one second. So my first question is for Dr. Tam. So the latest Public Health Agency of Canada weekly epidemiology report says the majority of cases, 58%, were exposed to an unknown source of COVID-19. Why can't we get more detailed information on where cases are coming from? We're telling Canadians to limit their activity, but why aren't you releasing detailed information on transmission rates in gyms versus bars versus backyard gatherings as examples so we can better learn about the risky behavior and where this is spreading?
Well, the indicator that you had mentioned is actually a very important one because, as you know, we get our reporting from the provinces and territories, and we keep track of that number because if you can't link your cases, that is telling us that perhaps there's more community transmission and hidden chains of transmission. You don't want that. You want the cases to be linked back to known sources of exposure, whether it's a case or whether it's an outbreak. So that is done at the local level. But we do monitor that parameter quite carefully and have discussions with chief medical officers if we see that proportion is larger than one would want to see. And that could be due to a whole variety of reasons, some of which is to do with the ability to turn the tests around fast enough in order to do contact tracing, etc. So, but what the number you mentioned is actually an important one.
Patty, did you want to add something?
Well, yes, I'll just add that is part of the $4.3 billion transfer to provinces and territories was to accelerate their abilities to do the contact tracing, but even, I would say equally importantly, ensure that their data systems are up to date. If you recall at the very beginning of COVID-19, we got data very little data and also with a large lag. Now the provinces and territories are doing better, but in some provinces and territories, you're right, there are 50% or more unlinked cases, which is an indicator that we watch very closely because it also implies that there is a higher degree of further spread when you can't pinpoint where people are coming into contact with COVID-19. And finally, I'll just say at the federal level, we have in the range of 1,500 additional contact tracers on loan to the government of Ontario right now through our Federal Reserve capacity. And this is something that is available to all provinces and territories, the ability to rapidly support provinces and territories with additional resources to get that number down.
It's Dr. New. Maybe I'll just add the real life sort of situation we're dealing with on the ground. I think it would be important for Canadians to understand that when we were, quote, in lockdown or what happened in the spring with cases, people, when you were doing the contact tracing, were able to identify, oh, I've been in contact with 5 or 6 people in the past, 2 weeks. Now what's happening when cases are being detected, the number of contacts has jumped to like 20, 30 plus. So that already is, I think, an important sign that things are not the same as they were before. And that's also why it's becoming more challenging and difficult on the ground, even if we have the resources to go and find, a larger number of contacts for every case that's been confirmed.
The ministers will now leave to go vote and fulfill their parliamentary duties. So we thank them, but the doctors are staying on for more questions.
So I guess this is for Dr. Tam. So how do these 7.9 million rapid tests fit into your overall testing strategy? Who will be prioritized to get them first? In which provinces? And how quickly will they be rolled out?
I think it all depends on what we're getting and the characteristics of the test. But some of the key attributes of a point-of-care test is to be able to be deployed to more remote areas, to areas where you can't sort of send your samples without a really long turnaround time and you have to fly your samples, for example. So I think the key priority is high risk and remote settings. There may also be more high risk exposure settings where it is really important to get that more rapid turnaround. So I think those will be some of the approaches. But again, this will be discussed with the provinces and territories and look at how they can best be distributed as well.
Thank you. Rachel Haynes here from CTV National News. My question is for Dr. Tam. On March 23rd, when you were speaking to us in West Block, there were over 1,400 cases cumulatively in Canada of COVID-19. Today now, or at least yesterday, we saw reported over 2,000 cases of COVID-19. On March 23rd, you said that people should stay home and do social distancing as much as possible. At that day, too, Minister Hyris said that if you have a capacity to work from home, do so. If you are thinking of going to a restaurant, think again and stay home. Also asking Canadians to conduct only essential business. Today, why are you not asking Canadians to do the same thing, and why are you not giving them that same advice?
Well, I think some of the same advice is provided, for example, in Quebec, in areas where they have been experiencing cases. So I think the difference is that at that time, there was a lot of unknowns about the virus. We knew practically very little at the time, but now we know a bit more. And the concept with the public health officers is that we don't want to apply just broad-based blanket approach to everywhere in Canada, but use the data that we have to try and home in on those hotspots and advise people who lived in those areas now to restrict their contacts. You've seen what's happening in the red zones of Quebec, where those kind of recommendations are being provided right now. But we also know of some of the negative consequences of broad-based restrictions and stay-at-home orders. So I think local medical officers are trying to still keep, as much as possible, those really important social spaces like schools open as much as they can, while closing, as you've seen, some of the nightclubs or bars and that type of thing. So I'm really happy that they're trying to do that to immediately reduce that acceleration of cases that we are seeing. So absolutely, some of those fundamentals do apply, but now I think public health is trying to do it in a more focused fashion.
Last week when you gave a press conference, it was about the modeling, and you said that we'd have around 155,000 cases by October 2nd on the worst end of the spectrum, as well as about 2,000 deaths too for October 2nd, which we're approaching. So clearly we have passed those projections, and we will pass those projections as well. So what can Canadians do now, or is it, at what point are we going to see these numbers go down again? I mean, we're seeing the RT level at about 1.4, so numbers are just going up exponentially at this point. What do you want to tell Canadians now in order to get those numbers down in the future?
Well, it's really important because right now we can do something about it to resuppress that trajectory. So bend that curve down is similar to what we had advised in the past, but certainly in the areas where the virus is really accelerating. So again, keep those contact numbers low, because I think what has happened during the summer and as social and economic spaces open, people are having more contacts. So absolutely, that's really, really important in the areas where the virus is spreading fast. That's the only way that I think we can reduce that acceleration as quickly as possible. All of those other public health advices continue. So I think you need to ask yourself, do I really need to do this particular activity? There's essential things that you must do, going to the grocery store and while keeping yourself safe. But I think this is the time where you should just cut down on anything that's generally non-essential if you're in those areas where there's a lot of viral circulation. And so I think that's really key. And, the whole hygienic measures, physical distancing, wear a mask. I think at the beginning of the initial epidemic, Canada wasn't a country where mask wearing was quite prevalent. Whereas now, even through surveys, I know it's uncomfortable, people don't like it, but a lot more Canadians, at least 75%, are actually very supportive of mask wearing. So that's another layer of protection to try and reduce transmission. No layers of protection is 100%. It's just adding more will dampen that transmission, that RT value, as fast as we can. So absolutely crucial moment right now, particularly in Ontario and Quebec.
Dr. Maybe I'll just add a couple of points. I think it's important for all Canadians to understand that we are in control of our own destiny. So the statistics and data we're giving you today, in many ways, are a reflection of the activities of what Canadians were doing about 2 weeks ago. And so even a week from now, if we give you further data and there's an increase in case numbers, it's probably a reflection of what happened a week ago. We can't change that, but we can change what we do today, and we'll see hopefully the fruits of our I say, changed behaviors 2 weeks from now. So I think, like I say, it's a bit of a catch-up game. We look at the data today, but it's really a reflection of what happened maybe 2 weeks ago. And so what we do today will make a difference. So let's see where we are 2 weeks from now.
From the Canadian Press. I'm just curious, we've seen several weeks now where particularly in Ontario and Quebec, testing backlogs have been growing. People are waiting in line, some are giving up. How concerned are you today, Dr. Tam, that this testing backlog is contributing to the rise in cases and the difficulty in contact tracing?
So, there may be a variety of reasons, and I don't know how many spots there are lineups. It may not be uniform across different areas of Ontario and Quebec, but we've seen those lineups. And I think partly public health authorities there have now been asking people who, if you it's a nice to know kind of test, don't line up right now. Please line up for people who have symptoms or who have the potential for having been exposed, or you're being told by public health, which is very important. So let's just reflect quickly on Ontario. I think they've been doing a lot of testing, really accelerated, and their percent positive is still relatively low. So it's 1 point something, I don't know what it is today, which means they're testing a lot of people to find those positives. So refocusing to the targeted areas like the Torontos and the Ottawas and Peel, I think, those areas is really important. You can't distribute your testing too broadly, but really home in on supporting those areas where you're seeing those accelerations. So some of it is simply access. Having those extra access points like pharmacies might help, particularly in those cities or those areas. Two is that absolutely it is worrisome, because if you have a significant backlog and people don't get the test results for a number of days, you've now lost time for doing the contact tracing. And so we can shore up the contact tracers, but if you don't know that someone's got a positive test, you're not going to be beginning the contact tracing, and that can help accelerate the spread. So it is something that we really must all work together to try and reduce as quickly as possible.
We also heard earlier today in a briefing that they've now sort of told the makers of these antigen tests, other tests, what accuracy they expect, sort of what the standards are. I heard you say earlier that you're starting to work with provinces and other public health chiefs about these tests and sort of what they might be able to be used for. Why are we only doing that now? Why didn't we do that 6 months ago?
Well, a lot of these didn't exist, and so the manufacturers of some of these rapid tests and antigen tests have been working really hard, and I'm really happy that some of them have now applied to the regulator in Canada. I mean, people have been doing outreach to different manufacturers. Someone has to submit these tests and make it available in Canada. So what we're doing in terms of public health guidance is we are now developing the guidance so that when the first antigen tests come on board and we can get access to it, we'll be ready with those recommendations. But, it's a complex landscape. There's global supply challenges as well. So I think what we want to do is see as many of these tests being submitted to the regulator so that we can have a bigger portfolio to draw from.
We are going back to the phones. Opérateur, prochaine question.
Operator, next question.
Merci. Thank you. La prochaine question, Micheline Laflamme de Radio-Canada. Please go ahead. Your line is now open. Votre ligne est ouverte.
Your line is open.
Merci. Dites-moi, comment expliquez-vous le taux de contamination qui est plus élevé au Québec qu'ailleurs? Est-ce que les écoles ont quelque chose à voir avec ça? Quelle est votre analyse de la situation?
Merci pour la question. C'est difficile pour moi pour commenter cette situation au Québec parce que c'est vraiment les autorités de santé publique au Québec qui sont plus au courant, qui ont vraiment les données probantes, qu'est-ce qui se passe, qui savent actuellement c'est quoi les situations épidémiologiques au Québec. Au début, l'hypothèse est que peut-être le virus a été introduit au Québec peut-être un peu plus tôt que le reste du Canada à cause de la relâche scolaire a eu lieu plus tôt au Québec au mois de mars avant le reste du Canada. Et les Québécois qui peut-être sont sortis du pays ont été contaminés peut-être en Europe, dans les autres pays, et puis sont retournés au Québec. Mais après, avec tous les efforts des Québécois et aussi les Canadiens à travers le pays, on a aplati la courbe pas mal au printemps aussi en été. Mais avec la situation aujourd'hui, je pense que le défi, c'est que tout le monde, je pense, est tanné de toutes les mesures de santé publique, confinement, tout ça. Et les autorités, je pense que c'est vraiment un défi aussi. Comment on peut, ouvrir l'économie, aussi les secteurs, aussi la société au fur et à mesure, mais aussi garder, comme on dit, un niveau d'activité de COVID-19 gérable. Ça, c'est vraiment le défi. Et on voit maintenant actuellement que avec les données que, oui, il y a eu des éclosions un peu partout, peut-être au Québec, surtout dans les zones rouges. Et ça, c'est le défi parce qu'au Québec, on a maintenant réimplanté des mesures plus, comme dit, sévères pour les zones rouges. Comme explication pourquoi peut-être les taux sont plus hauts au Québec, je ne sais pas, mais c'est intéressant que les autorités de santé publique, même le premier Legault et aussi Dr. Arruda, j'ai entendu hier que c'est vraiment des mesures dures. Et on sait que les Québécois, on aime faire le party. Hein? C'est quelque chose peut-être qui a fait partie de la culture au Québec. Et maintenant, ce n'est pas le temps de socialiser. Même un défi peut peut-être arrêter les rassemblements, même de famille, pour 28 jours. Donc, c'est peut-être une possibilité, une explication pour ce qui se passe actuellement au Québec. Merci.
Et en ce qui concerne l'application COVID-19, là, elle est déjà en fonction dans plusieurs provinces, ou du moins dans quelques provinces. Est-ce qu'elle a déjà montré son utilité? Pouvez-vous nous dire, alors que le Québec envisage peut-être de l'utiliser, de quelle façon ça a changé la donne dans ces provinces-là?
Je pense que c'est sûr, l'application à la COVID, d'après moi, c'est toujours mieux si c'est disponible à travers le pays, que toutes les provinces et territoires utilisent l'application à tous les résidents, les citoyens de chaque province et territoire en accès. On peut télécharger l'application. Je sais que peut-être il y a quelques semaines que le gouvernement du Québec, à ce moment, a dit que ce n'est pas le temps pour le Québec. Ils ont fait leur propre analyse, mais la porte est toujours ouverte. On continue d'avoir des bonnes conversations, une bonne collaboration étroite avec les autorités du Québec. Et je sais qu'ils sont en train encore de faire, une autre analyse et avec la situation qui se présente actuellement au Québec. Je pense que on continue d'avoir les conversations et moi, personnellement, j'espère peut-être que l'application sera disponible partout au pays, incluant le Québec.
Prochaine question en ligne.
Next question over the phone.
Merci, thank you. La prochaine question est de Anne-Caroline Desplanques du Journal de Montréal. Votre ligne est ouverte. Your line is now open.
Oui, bonjour. Ma question porte sur les tests rapides qui ont été annoncés avoir été réservés un petit peu plus tôt pendant la conférence de presse. J'aimerais avoir un petit peu plus de détails sur ces tests. Donc, ce serait le test rapigène. Quel serait le temps pour l'approbation de ces tests-là et donc leur distribution?
Moi, je vais commencer. Les tests rapides qu'on a annoncés aujourd'hui, ils sont encore en train les autorités de réglementation à Santé Canada, nos collègues, ils sont en train encore de faire leur analyse, leur évaluation, mais on espère que l'approbation peut-être aura lieu peut-être bientôt, mais je ne peux pas dire, vous donner une date précise. Le but de ces tests rapides, on a déjà constaté, c'est aussi la plateforme, c'est basé sur le PCR, c'est comme une autre dépistage moléculaire. Et l'utilité de ce dépistage est vraiment au point de service, donc je pense dans les communautés plus isolées. Je pense que dans le Nord, peut-être les communautés aussi avec les Autochtones, c'est vraiment un défi maintenant actuellement parce que si quelqu'un, peut-être on pense que quelqu'un est contaminé avec la COVID-19, il faut prendre des échantillons, il faut avoir le transport au laboratoire au sud. Avec un test rapide, plus comme des points de service, c'est possible d'avoir un résultat plus rapide, même dans 15 minutes. Donc, ça, c'est le but en général, mais c'est sûr, on va avoir des autres, applications, utilisations pour cette technologie quand c'est approuvé.
En question suivie, c'est bien le test rapigène de la compagnie sud-coréenne Rapigène. Et puis, ma question de suivi, c'est sur le niveau de sensibilité. C'est un test, celui de cette compagnie, qui est déjà critiqué en Asie pour son faible niveau de sensibilité. Qu'est-ce que vous pouvez nous dire là-dessus?
OK, j'ai mal compris la question. Je pense que vous avez parlé de le test Abbott aussi comme dit test plus rapide, point de service. L'autre dépistage que vous avez mentionné, moi, je ne suis pas au courant exactement c'est quel le nom de compagnie.
Mais si j'ai bien compris, l'annonce plus tôt tout à l'heure, c'était de Rapigène. Est-ce que c'est bien ça?
Oui, c'est ça. Oui, en anglais, Abbott ID, oui, c'est ça. C'est des laboratoires Abbott. C'est une technologie de dépistage moléculaire pour avoir des résultats en point de service. Et la question, c'est?
C'est sur son niveau de sensibilité à ce test-là.
OK. Ce qu'on comprend maintenant, peut-être je peux laisser aussi aux autorités plus les experts, mais ce que je comprends, la fiabilité, la sensibilité de tests rapides de Abbott, c'est pas mal pareil, plus semblable à le PCR, le test au laboratoire, comme dit, c'est une norme d'excellence. Donc, c'est pas mal pareil.
Merci beaucoup. Ceci met fin à notre conférence de presse. Thank you, everyone.
Thanks. Hi, Tom Perry with CBC. Can I ask you about out in BC, they're using the swish and spit test. Is that something that we're going to see coming across the rest of the country? And why is it that we're seeing it in one part of the country right now and not in others?
Yes, and I think you will see more of that. It's been worked on in different parts of the country with different provincial laboratories for a number of months. And I think our national lab is more there for sort of standardization as well, so that people can consistently apply the test. Now, the saliva swish and spit is a collection method, so that the sample still has to then go back to a laboratory. So it's a more pleasant method and maybe one that doesn't utilize as many healthcare personnel resources. And so I think it is something that we will see other jurisdictions will want to take on as well.
And can I ask you just in terms of all the House is back now, we're hearing politicians talking about we've got to speed things up, we've got to do more like our allies. Why do they have some tests and we don't? Is there any way for politicians, do you think, to try and get researchers to go faster, say, step on it, get to work on this, not say, approve this, don't approve that? Or is that inherently politicizing the whole process of approval?
I think for sure you have to leave it to the science and do it properly. Now, it's just like with vaccines, with treatments, with diagnostics too. The whole world is working on this. So we are getting a lot of different, Health Canada has already approved 37 different types of testing sort of tests. And so more will come along. I think the next generation of testing will come along and we will sort of look forward to it. But we, not me personally, but other members of the health portfolio and public service and Procurement Canada is trying to contact manufacturers and say, what more can be done to speed up things? So I think at every point, people are trying to see if the timelines can be addressed, but with good reason, with good science, you can't sort of skim safety and effectiveness. So I think that's the key. Health Canada, as the minister has said, is doubling up on human resource and trying to review files. But the companies also have to return those questions and some basic information as fast as possible. So, I would just appeal for people in every step of these critical paths to do as much as we can. But I think also I just like in vaccines, I haven't seen the diagnostic sector work this fast before either. But there is a global demand, so it is a complex environment as well. But I think we will try as hard as we can, pulling all stops like with the other countermeasures. Thank you.
Yeah, Dr. Maybe just another point I think that's worth noting. You're mentioning about all these tests available in other countries around the world. It's interesting. This is even before COVID-19. Sometimes Canada. We suffer because we're a small market globally. So even for certain types of drugs or certain devices and so on, an international company may not even, quote, bother. I think it's not worth it for various business reasons to maybe even apply to have their product licensed in Canada. And so I think in some ways that's also playing out with COVID-19. So certainly we're taking all the measures we can to encourage manufacturers, be it for testing, technologies, drugs, whatever, that they should approach us, come to our regulators, submit a sort of something for approval and give us the data. So hopefully we can go through our regulatory process and approve something that could be of benefit to Canadians. Thank you.
Thanks, everybody. Merci.